The U.S. Arab Radio Network is the largest Arab and Muslim radio network in America, broadcasting throughout the Midwest region Monday through Friday on WNZK AM 690. U.S. Arab Radio features Arabic and English language programming on every topic, from health, food, and culture to government, politics, and legal issues. Listen live to U.S. Arab Radio in Michigan, Toledo, Ohio, and Windsor, Canada on WNZK AM 690. And in Washington, D.C., Maryland, and Virginia on WDMV 700 AM. You can also follow us on Facebook, Instagram, X, and TikTok. So join us every day on the U.S. Arab Radio Network and check out our website at www.arabradio.us. This program is sponsored by IVF Michigan. For your appointment, call 248-487-8084. That's 248-487-8084.
Good morning and thank you for being with us. This is Khalil Hachem with US Arab Radio. We have a great show for you today. You know, having children is stressful as it is, and sometimes it takes more to try again and work with the expert to have this joy of life. And with us this morning is Dr. Nicholas Shamma. He's an expert. He's an expert on IVF. Good morning, Dr. Shamma. Thank you for being with us.
Good morning to you, Khalil, and to all our listeners this morning.
Absolutely.
Here in Michigan.
Absolutely. Thank you so much for being with us. Well, before we start with the issues that we're going to discuss, I just wanted to ask you very quickly, what's the update? I mean, this is the time where we'll start dealing with flu, with COVID, with any of this. What's the update on that?
The update is like every year, we're going to get them. There's no question about it. And people ought to be vaccinated prior to the flu COVID season. Now, COVID happens in waves and it's everywhere. And now we have a new variant coming in. And people need to be vaccinated with the most up-to-date vaccines. Now, people currently there is a vaccine for the flu that is available, and then the current updated COVID vaccine is also available, and mainly it is for high-risk populations. That's what it's recommended. So people like me, my age, and similar people, and people also trying to conceive, in my opinion, should get both the flu and the COVID vaccine before attempting pregnancy, before the flu season, if they're going to be pregnant in that season. Then the best vaccines to take, as far as, in my opinion, as far as the COVID vaccine would be the protein-based vaccine, not the mRNA ones. And people are shying away from those, but clearly the Novavax COVID vaccine would be the one to
Sure. Do these vaccines affect what you do?
They don't affect, but they prevent people from getting sick while being very pregnant. Imagine you're going through IVF and finally you're pregnant and all is well, and then you catch COVID or you catch the flu, and all of those have major ramifications. And in previous discussions, we have discussed other vaccines that are necessary for people embarking on pregnancy and so on, that they should take before pregnancy and make sure that they're immune to those viruses, and clearly also some that are necessary during pregnancy, especially in the second and or third part of pregnancy.
Yeah, sounds good. Thank you.
The
other issue we wanted to get into is stress in conception, how chronic stress can affect ovulation, sperm health, and overall fertility potential.
Yeah, I mean, here's the thing. I mean, having kids is not a walk in the park. You know that, I know that, having 6 kids and so on, of my own. And I have to start by telling people it's an obvious fact that kids, 90% of the time they're in pain. Pain in our sides.
Yeah. And you know what?
Yes, whatever. But it's that 10% of joy that they give us that perpetuates the human race and makes us have kids and enjoy them and so on. And I'm going to encourage everybody to have kids because this 10% gives us ultimate joy and allows us to keep on living and keep on feeling younger and so on, despite aging. And that includes us having kids and our kids having also kids of their own. So all of those give those perpetual joy feelings throughout our lives as humans. With that being said, for the 10-12% of humans that cannot have kids, I mean, there is no question in my mind, and NPS studies have corroborated this, that infertility itself causes a lot of stress and a lot of anxiety in those people. And I think our discussions today, Khalil, ought to be divided maybe into 5 or 6 different parts. Number one, we can discuss, for instance, physiologically and very briefly, because this is
Sure.
sometimes complicated. How does stress affect procreation or normal menstrual cyclicity or the ability to produce the necessary hormones for and how it affects reproduction also in women and men. The second part ought to be a discussion on how does that affect fertility itself. I mean, is there an effect on fertility, stress in general? One is reproduction and the other one is fertility. The third one should be does it affect the success of, let's say, assisted reproduction, in vitro fertilization, the stuff that we do or we do not do in helping women try to achieve pregnancy? And in of itself, we should also discuss, does the fact that they are stressed affect with that fertility, especially during going through IVF? And lastly, and that should be the concentrated part, maybe at least some time to discuss what can we do as far as physicians, practitioners, whatever, and what can patients do on their own to improve that journey so that they can feel less stressed, less anxious, less distressed when they go through fertility treatments. And we'll talk about why those are significant. And there are certain measures patients can take and couples can take to diminish the chances of them being overtly anxious, stressed out, depressed during those journeys. So, I mean, maybe we can start,
Sure,
if you wish, by explaining how theoretically.
Yes, absolutely. Let's start with the women.
No, I'm going to start generally speaking first.
Okay.
Let's affect reproduction. Here's the thing. There are hormones in the brain secreted by the hypothalamus pituitary glands. These are structures in the brain whereby if you are stressed, and that can be sometimes measured by measuring cortisol in the blood or salivary amylase and so on. If you're stressed out, the hormone that is produced is called CRH. This CRH hormone inhibits the ability of your brain to send the signals necessary for your ovaries and your testicles to produce the necessary hormones, and that's how theoretically it affects reproduction. With that being said, I mean, it's plausible in terms of functionality and in terms of science, but then the applicability of this notion of whether it affects fertility is debatable to some degree, and we'll talk about that in a minute.
Sure.
The second issue in my mind ought to be, does stress, does depression, does any of that stuff affect the chances of getting pregnant and how quickly you get pregnant? Because these are two separate things. Now, clearly, if you are severely stressed out during times of war or famine or whatever, especially for women, and your cycle stops and you do not ovulate, then at the end of the day here, Khalil, you are not going to ovulate, you're not going to get pregnant. Women will not be able to conceive. But that implies two things. It implies severe stress and in concert with this severe malnutrition. And that sometimes occurs in the context of excessive exercise. So clearly that stress can affect ovulation and therefore lack of pregnancy. On the men's side, does stress generally affect semen parameters and does it affect the likelihood to conceive? The data is softer there. Most fertile people during times of stress, they don't see any changes in their fertility potential, what we call the fecundability rate, the chances of their partners getting pregnant. So in men, it is less so maybe than in women. So even though theoretically it is plausible that stress affects procreation, and stress could affect fertility and the time to achieve a pregnancy, generally speaking, unless it is so severe, it is unlikely to have a material impact on the odds of a couple getting pregnant.
Yeah.
So that is maybe those are the two things that are relevant in those situations. Now, is it different between men and women? In my opinion, it's only different that women are more sensitive sometimes to changes in stressors, basically affecting their menstrual cycle. And if it does affect ovulation, there's no question about it. Some people argue that during periods of stress, some women tend to overeat. Again, obesity in of itself is a major cause of anovulation or lack of ovulation, or disturbed ovulation, ovulatory.
How does it affect that?
Well, it affects that through insulin resistance and so on if you become obese. But then most people during severe stress actually stop eating.
Sure.
So that is more likely than the other spectrum of But clearly, both of them affect ovulatory dysfunction. Now, with those things being said, the big question then comes up in terms of me and what I do for a living, which is most of the time things related to assisted reproduction, meaning having people undergo in vitro fertilization, getting pregnant, and so on, is does stress affect the success of in vitro fertilization? And I think before we answer that question we should mention that a lot of studies have shown, by the way, that infertility itself is a major cause of stress. Infertility itself is a major Some people equate that to the amount of stress, and there are certain ways we measure actually stress and so on. Equate that to, and we'll talk about those in a minute if you wish, equate that to how much we are stressed if, God forbid, we get diagnosed with cancer of some sort. That's severe. So the issue is around 30 to 50% of women who are undergoing infertility treatments and have infertility are stressed. 30 to 50%, imagine. And some of them are even depressed because of the notion that they are infertile. And if you add depression 30 to 50% are stressed and maybe 30% are literally clinically depressed. And the same to some degree, maybe lesser a little bit in men. So infertility itself causes stress. The treatment for infertility causes stress because there are uncertainties in the process. I mean, it's not like when you buy a car, you pay money, you get the car, no matter what car it is.
Sure.
Here, it is uncertain, meaning the whole process, you can go through it, but it might not result in pregnancy.
Exactly.
So this uncertainty burden basically is felt as a major stressor. And we're going to talk a little bit about what are the things we can do or we can offer patients and what they can do to ameliorate that, to make them feel better. But this uncertainty is not clear. Sometimes even the timeline is not clear. It is not clear to them how do they go from point A to point B. And I always tell my patients that the workup usually will take a month and a half, and the process itself to go from the beginning of, let's say, doing in vitro fertilization to the end, generally speaking, takes around maybe 14 and a half weeks. So it's not a walk in the park.
Sure.
At 14 and a half weeks, Khalil, they have to be able to maintain their well-being, maintain their relationships, maintain their family life, their partnership with their spouse, and so on. So this uncertainty in outcome is a stressor. The length of the process is potentially another stressor. And then you have to add to it the thing is the financial burden. I mean, it's not all of the time covered by insurance. Only 30 to 40% of patients that come to me have insurance coverage, let's say for in vitro fertilization, and the other 60 to 70% don't.
Yeah, yeah.
And especially if you live in a state,
Financial stress, yeah.
this financial burden, stress,
Yeah.
is cause of stress.
Yeah.
And again, there are ways to get over that concern. So those are why people, generally speaking, going through assisted reproduction feel in a little bit, to feel stressed out, to say the least.
Yeah, yeah. I want to take a short break and then we'll be right back. Please stay tuned.
Sure.
With more than 30,000 successful in vitro fertilizations, IVF Michigan is now ranked as one of America's best fertility clinics, according to Newsweek magazine. IVF Michigan fertility centers are the recognized leaders in high-quality fertility care. With locations in Bloomfield Hills and 9 other cities in Michigan and Ohio, IVF has experts in all aspects of the field. A founding member, American board-certified Dr. Nicholas Shamma, is one of the leading reproductive endocrinologists in Michigan and Ohio. He has performed over 20,000 successful IVF cases, and it's helped thousands of couples fulfill their dreams of parenthood. When it's time to get personalized care from Dr. Nicholas Shamma at one of America's best fertility clinics, call IVF Michigan Fertility Centers in Michigan and Ohio toll-free at 855-952-9600. 855-952-9600.
Welcome back and thank you for being with us. We're talking to Dr. Nicholas Shamma. We're talking about stress and conception. Dr. Shamma is a leading expert in reproductive medicine, and we're going to be exploring more the connection between stress and infertility. Before the break, Dr. Shamma, we were talking about that relationship between stress and how it affects the operation of whether somebody, financial stress, the stress itself of having a child, and whether it's going to work or not. Now, does it weigh more on the woman than on the men?
Well, studies have shown that actually it weighs equally on both men and women.
Mm-hmm.
But to some degree, women have to undergo almost everything. I mean, we
Yes.
are most of the time bystanders, apart from providing sometimes a semen sample. That's the extent of our involvement.
Sure.
Sometimes, rarely, we have to go to the testicle to get sperm. I mean, that's a surgical procedure. That could be a stress-inducing event.
Yeah.
Most of the time, everything else, including the 9 months of pregnancy and the tribulations that can happen while pregnant, are stress causing. I mean, it's, again, I always tell my patients that pregnancy itself, I mean, is clearly not a walk in the park. And it only took 3 weeks and then we have a baby, but it takes 9 months to have a baby. So, and a lot of things happen, and there are changes in your body and changes in the way you move and so on. All of those things affect your well-being.
Yeah.
And your ability to enjoy life, and so now clearly on the flip side, if you get pregnant, it's a major source of enjoyment because you're thinking of the outcome. Okay, you're gonna have a baby, you're gonna play with it, you're gonna raise it, and all that other good stuff. So that is important. There is one aspect that we haven't talked about that is extremely relevant. We live not in a bubble. We live part of society.
Mm-hmm.
Society is divided into it takes a village to raise a kid, but it takes the village sometimes could be disheartening in the process, because you could have friends that have kids that you might create in you feelings of why me, feelings of envy or whatever. You also might be part of a family group or an environment that they keep asking you, what's your problem? Why can't you have kids? I mean, we all have kids, and aren't you trying enough? I mean, I hear that all the time. I mean, those negative thoughts or feelings from the surrounding
social pressure, and
friends can exacerbate the feelings of distress in the couple trying to do this. Add to that the effect on relationships. I mean, imagine you have to have, instead of having intercourse or sexual activity when you like to have it, it becomes a routine. It becomes like, okay, I'm ovulating now, you've got to have sex today. And to do that, I mean, and some men can perform under duress, and then nothing happens.
Yeah.
So that adds to the stress. The more it doesn't happen, the more it's your stress, and the more it doesn't happen. So again, sexual activity on demand, or when becomes less pleasurable. So what I'm trying to say is that all of those factors, whether it's the relationship between the husband and wife, could be contributing to stress-inducing feelings. Also, the environment itself that we live in, meaning the social environment, can sometimes exacerbate the feelings of stress and distress and so on, and is not helpful.
Yes.
Okay. And then we'll mention in a little bit, there are certain situations where your family is supportive, your environment, your immediate environment, or your social group is supportive of a healthier journey. And we'll talk about that when we talk about.
Yeah. That reminds me when we had, Yusuf, and he's 19 now, but when we got married, and my mom would call every day. She wanted to find out, are you pregnant? Are you pregnant? Are you pregnant? And then my wife got sick. She really got sick. And I mean, she eventually she conceived naturally, but the pressure, and then my mom kept saying, whatever the Lord sends is great, but we want a boy.
Yeah, sure.
That put a lot of stress on her, And then I said, listen, you need to relax, and this would happen naturally. Don't worry about it. Don't worry about my mom. And then it did happen naturally, thank God.
Yeah, well, I mean, in the treatment part of our discussions today, if you wish, we can talk about the importance of certain techniques or certain aspects of things one can be done. But maybe we can talk even, if you wish, about the importance of having faith in a higher power that sometimes can help in this process.
Yes.
We'll talk about that later, especially because I mean, we're in our Middle Eastern community, that notion of divine intervention and divine power plays a pivotal role in our lives, actually, myself included. So maybe we can talk about that in a little bit.
Yeah. What we're going to do is we're going to take another break. We'll be right back. Please stay tuned.
حاولنا كتير.
خلينا نحاول كمان مرة.
الكلفة كبيرة والاحتمال ضعيف.
يعني ما في أمل؟
للأسف حبيبتي.
هنالك أمل لدى مركز إخصاب IVF ميشيغان، الذي صنف من بين أفضل 50 عيادة إخصاب في أمريكا وفق مجلة نيوزويك لعام 2023. ويعتبر الدكتور نيكولاس شاما مؤسس مراكز IVF ميشيغان وأوهايو من أهم أخصائيي العقم في أمريكا، حيث أجرى أكثر من 20,000 عملية طفل أنبوب ناجحة حققت حلم الأبوة لكثير من الآباء والأمهات، وهو حاصل على البورد الأمريكي في أمراض النساء والتوليد والعقم والغدة الصماء التناسلية. الآن ولفترة محدودة خصم $1,000 للحالات المؤهلة لإجراء عمليات في عيادات IVF ميشيغان. لمزيد من المعلومات يرجى الاتصال على 2489529600. IVF، أمل يولد من جديد.
Welcome back, and thank you for being with us. This is Khalil Hachem. We're talking to Dr. Nicholas Shamma. We're talking about the IVF, stress and conception, and whether it is social stress, financial stress, and as Dr. Shamma mentioned before, also the fact that the having a children is a stress by itself. Dr. Shamma, what can we do to relieve that stress?
Okay, I'm gonna start by saying something. I mean, there was the ad that mentioned U.S. News and World Report. We are very proud to be. Every year we're number one in Michigan and in Northern Ohio. So I mean, but not just 2023,
Sure.
whatever. And we're very proud, actually. I should mention this, that recently we joined a larger group. I mean, IVF Michigan, IVF
Sure.
fertility centers are part of now the Pinnacle Network, fertility network, and we are very, very proud that we are part of that network. And it allowed us to introduce systems and technologies, not that in the medical field, but in terms of the collaboration with other various very large centers to allow us to achieve better integration, better results, better patient care, better everything. So we are very, very proud that we are part of that. And the fact that we offer every form of fertility treatments at IVF Michigan, IVF Ohio, and through our surrogacy agency, the Gift of Life Surrogacy Agency, which is a separate entity. But I mean, we offer the whole spectrum of the whole thing.
Sure.
And we've been doing this for the past 30 years.
I spoke with someone the other day, and I mentioned that we're going to do the show. And the minute I mentioned your name, and her eyes got so big, and she said, "If it weren't for Dr. Shamma, I would have not had my 2 children." And she just kept talking about it as you're the miracle man.
I'm just a little peg in the, I mean, the little helper in the whole process.
Yes.
It's almost miraculous, actually, to some degree, what we're doing these days in the laboratory and how much we can help people. And thank God for the technologies and for the science and the know-how that allows us to do that. With that being said, I just have to mention that we talked about that briefly, that if you look at, was a major study in the British Medical Journal that looked at 14 different studies, what we call a meta-analysis in medicine, that clearly showed that if you're undergoing IVF, it doesn't look like stress affects outcome. Okay? I mean, this is really straightforward here. Now, there are, though, as we mentioned, the fact that stress doesn't affect the outcome of IVF doesn't mean that there is no stress. Doesn't mean that there is no stress in the process. And I apologize. So I should have put it on do not disturb, and I did now.
Yeah.
So the point that I'm saying is that it doesn't look like stress affects the success of in vitro fertilization for all that matter. Now, there are ways where we can actually measure stress. And we actually, every time patients come to the office, we ask them, how are they feeling, whatever. But there are even structured, scaled systems that allows us to determine whether somebody is stressed or distressed or depressed. And I mean, one you can download as an app on your phone.
Yeah. I do have that. And it gives me a notice saying you're too stressed.
Yeah, there's something called the PHQ-9. I mean, you do it, you answer a bunch of questions, tells you how much stressed you are today or not, or tomorrow. Now, we always encourage our nursing staff, our front desk people, our even laboratory people that draw blood and so on, by improving their emotional IQ and improving their empathy feelings towards our patients and chaperoning them during this whole process. So that's the job that we have in this situation.
Yes. Yeah.
So what I'm trying to say is that this is all extremely relevant in us in offering the services that are needed. Now, when we talk about treatment, it becomes a completely different story, or management of the stress. That's what I think we should discuss. And there are tiers. And before maybe we talk about those tiers in management, we should emphasize that we follow guidelines that were established by two major consortium of agencies. One is called the European Society of Reproductive Medicine, and the other one is the American Society of Reproductive Medicine. One is called ESHRE and one is called the ASRM. Now, in ESHRE, everybody going through fertility treatments gets psychological management treatment.
Sure.
Everybody.
Sure.
In the US, there are certain guidelines that ASRM, the American Society of Reproductive Medicine, have established that allow us to think of situations that necessitate management, because everybody's stressed out to some degree. Some are more than others, and tells us what are the qualifications and when we should send people to see certified mental health professionals, and when do we even take it a notch further to offer them psychiatric treatment, and because you can't force someone
Sure.
in those situations. So in the US, we screen everyone, Khalid, when they come to us undergoing, and we screen them by talking with them through questionnaires, through various aspects. And if the patient tells us, or we notice that they have major issues, we offer them mental health professional treatment so that they can take it to the next level, whereby they can be offered the different treatment modalities or offerings that we will discuss. And finally, we tell them, if that is not even enough, go see a psychiatrist, and the psychiatrist can offer medicines, including antidepressants or SSRIs, and not all of them are safe in pregnancy and so on. So that has to be done always in concert, I should say, with us reproductive endocrinologists and surgeons, so that they can go through the process safely. And just to give you an example, for instance, a lot of people for anxiety take Xanax or take Ativan or something that it's a very potent anxiolytic dose, or Valium, and they can feel better. They'll feel less anxious, but those are absolutely contraindicated in pregnancy.
Sure.
Now, antidepressants or SSRIs in general, which some of can decrease anxiety for sure, are helpful, but some of them we don't advocate using them, for instance, and others we do. For instance, Lexapro is more commonly used because it has been shown, according to JAMA Psychiatry, that it's a little bit better than the other ones in terms of tolerability in pregnancy and side effects and so on. And clearly in the third trimester, we advocate that they go off them because it can affect the baby when the baby is born, because the baby will be hyper since suddenly the baby got rid of those SSRI medications. They're called they're serotonin uptake inhibitors. So, in generally speaking, the going from screening to evaluation to mental health professionals to psychiatrists to medications usually follows that route. However, there are and that's where we can talk now for the last part of this hour, is there are certain things, there are certain processes, Khalil, that patients can do, and we advocate them doing them, that they're divided into, in my opinion, into basically 2 or 3 modalities. So let's talk about the first one. The first one is used by us and by mental health professionals before they see the psychiatrist, generally speaking, and it is called cognitive behavioral therapy. So cognitive behavioral therapy is one, and then there is another one that is usually also used, which is called mindfulness-based stress reduction. So we're going to talk about a little bit about cognitive behavioral therapy. Then we're going to talk about mindfulness-based stress reduction, MBSR. And then there is another one called acceptance and commitment.
Okay.
So those are 3 things that we will discuss in a little bit. And patients and listeners this morning hopefully will learn certain things that they can do themselves, even without a health professional, utilizing those approaches. In addition to this, in my opinion, there are certain lifestyle, what we call ancillary things they can do, lifestyle modifications and behavioral changes that clearly affect the outcome. So let me give you an example. And I'm going to start with that before we talk about the different things.
Sure.
For instance, exercise helps.
Mm-hmm.
We're not talking about excessive exercise. I'm talking about moderate exercise.
Moderate exercise, yeah.
Moderate exercise allows you to go outside, to enjoy life, talk to people while running, while walking, while doing, and that can improve, and it has been shown to improve cortisol levels and to improve amylase and salivary amylase, so decreasing stress. So that is clearly one of them. Adequate nutrition, I cannot underscore how important that is. In meaning, and our diet is the best diet. The Mediterranean diet is the best fertility diet, period.
Sure.
There's one similar to it called the pro-fertility diet. So if they do that, they will feel better. They'll eat healthier. They'll feel healthier, and it allows them to have a better outcome, even has been shown to have a better outcome. The third one is what I'm going to call it sleep hygiene. Sleep is important. If you don't get enough sleep, and I heard that you were under the weather last night. I mean, you're not feeling good this morning, potentially.
Yes.
Sleep hygiene is extremely relevant during this process. And remember, stress, depression, anxiety makes you sleep less. There are certain ways that allows you to overcome poor sleep habits, and by integrating nutrition and sleep, and when you sleep, in terms of having a good amount of sleep so that you can feel better next time around. In tandem with all those three things, I think I should emphasize that sometimes avoiding substance abuse is paramount. For instance, some people that are depressed, anxious, whatever, start drinking, start smoking, start doing marijuana, start doing other things that have negative impact on the success of in vitro fertilization. Then you could have a negative impact. So those are four things that are ancillary to what I'm going to discuss in a minute. So briefly, let's start with what we call cognitive behavioral therapy. Cognitive behavioral therapy is used by mental health professionals, but basically what it does is it reframes maladaptive behaviors. And as a result of this reframing, it allows you, in a sense, to target your maladaptive behavior and put them in a different context. Starting from the notion that in cognitive behavioral therapy, that thoughts affect feelings and feelings affect behavior. So this is the usual progression of things. And what happens is that it targets your bad thoughts so that they do not cause bad feelings. For instance, you might say, it's my fault. I am broken. I am never going to get pregnant. So you target the thoughts so that they do not lead to bad feelings, and they do not lead to feeling distressed, depressed, whatever it is. So there is what we call behavioral restructuring. Restructuring. And this type of behavioral restructuring, in a sense, allows you to overcome those bad thoughts that eventually will not lead to bad feelings. And we offer them during treatment what we call behavioral solving therapy, meaning that we can tell them there is better ways to cope with financial distress, correct? Because there's financially demanding. We will tell there are ways to cope with the timeline, the fact that it takes around 14 and a half weeks to O from A to Z. There is ways to cope with the uncertainty in the outcome. And all of those things are part of what we call cognitive behavioral therapy. Knowing your maladaptive thoughts, reframing it and restructuring it in ways that allows you to have a better outcome. The second thing, which is interesting, is what we call mindfulness based stress reduction. Now, this is a longer thing, and what does it mean? It means that you have to be, in a sense, Khalil, non-judgmental in your awareness of those bad feelings and bad thoughts. And that allows you to basically have less distressing thoughts, generally speaking. Meaning that if you can you're aware of those thoughts, they exist. The feeling of fear, the feeling of sadness, the feeling of distress, you're aware of those thoughts and therefore feelings, but then you engage in activities that will make you happy. For instance, you engage in meditation, you engage in what we call imagery, you engage in breathing techniques, you engage with friends, with family, with colleagues, outdoors. So you, in a sense, try to have the thoughts, but then you do other things during the rest of the day that allows you to overcome those thoughts by having relaxation techniques, by having imagery techniques, by having engaging in sports, in exercise, in friendships, in going to movies, in doing all those other things. And clearly that all of those do not maybe change the outcome of IVF, but improves the quality of life during in vitro. The quality of life becomes a major issue here. And I mean, it doesn't hurt. And in my opinion, it allows you to have a better journey from A to Z till God willing, at the end you'll have a baby. Now there is a go ahead.
That's really a growth, incredible growth of the person during this process. You know, whether it succeeds or not. I mean, they grow to become totally a better person.
You know what? I have been through hardship in my life. You have been through hardship in your life. I have been doing this infertility for 35 years since I did back in 1992, 33 years. But to make a long story short, I use those techniques in my own personal life. And I've lost a son, he was 16. So I use the same techniques to allow me to get out of the misery. And I mean, the pain is always there, but I try to reframe my thinking that in other things, in pleasurable things with my wife, in pleasurable things with my patients, that allows me to concentrate my path going forward in different directions.
Clarity,
Just clarity. It's the thoughts do exist. The thoughts affect feelings, but then you try to go in a direction that allows you to function. And by helping others, by making others happy, by making your other kids happy, it allows you to overcome the obstacles and whatever pain you have or don't have. There is another, you remember I said there is cognitive behavioral therapy, there is also this mindfulness-based stress reduction, but there's something called acceptance and commitment therapy. I mean, it's a sort of longer thing, but and I'm going to tie all of this a little bit, if you wish, to how feelings of religiosity helps in this process. For instance, the acceptance has to do with acceptance of uncertainties. You've got to accept that certain things in our life we're uncertain about. We're not certain when. I mean, we might know when we'll get born, but we don't, or we're not aware.
Sure.
We don't know what will happen tomorrow. So acceptance of uncertainty allows you to basically maybe frame it in your mind as an option that it is going to be uncertain, allows you to deal with it a little bit better. And you have to take that acceptance and live according to your core values. Let me explain to you what I mean. people feel disappointed, some feel sad, some feel envious, some feel all of those things. But they can't, I mean, they feel it because
Exactly.
it's a
That's
fact.
life.
That's life. But then instead of fixating on this, you commit to doing other things in your relationship with your husband, in your health, in your work, in your everything else that allows you a more pleasurable approach. Just, okay, it is going to be uncertain. It is going to be financially draining, potentially. It is going to be a longer process, but I'm going to engage in this, that, and whatever to allow me to feel better, knowing that I am going to feel sad, distressed, envious, whatever it is.
Which is normal.
Which is normal, which is absolutely normal.
Yeah.
So all of those things, in my opinion, could be integrated with the nutrition, the exercise, the sleep, hygiene, and avoidance of substance abuse that can help us in navigating this longer journey of infertility. And almost all patients that do this stuff that we tell them to do feel better at the end of the day and can come out of it a better person, like you mentioned, even if the outcome is negative.
Exactly.
So with that being said, this maybe we'll spend another few minutes here, 10 minutes.
Yeah, before we do that, let's take our final break and then we get into that right away. And then we're gonna talk about the success as well. Please stay tuned. We're gonna take another break.
With more than 30,000 successful in vitro fertilizations, IVF Michigan is now ranked as one of America's best fertility clinics according to Newsweek magazine. IVF Michigan fertility centers are the recognized leaders in high-quality fertility care. With locations in Bloomfield Hills and 9 other cities in Michigan and Ohio, IVF has experts in all aspects of the field. A founding member, American board-certified Dr. Nicholas Shamma, is one of the leading reproductive endocrinologists in Michigan and Ohio. He has performed over 20,000 successful IVF cases, and it's helped thousands of couples fulfill their dreams of parenthood. When it's time to get personalized care from Dr. Nicholas Shamma at one of America's best fertility clinics, call IVF Michigan Fertility Centers in Michigan and Ohio toll-free at 855-952-9600. 855-952-9600.
Welcome back and thank you for being with us. We are discussing stress and infertility. And Dr. Shamma, we got 10 minutes left. If we we talk about the growth, we talk about by the way, the woman that I was talking to, she was marveling about the support you provided her during the journey. It was incredible support, which is really, really important. And then let's talk about the success as well. Before we went on break, we were talking about the spiritual aspect and the role it plays.
Well, I mean, I think for people like me, and God only knows that I am religious in many ways in my life. And it helped me throughout my entire existence on this planet. And I think most of our Middle Eastern community that are listening to us today, and everybody else who is listening that is so, it might be very helpful in the process of infertility. And I think it's helpful because religious beliefs in a higher power and whatever, and in trust in a higher power, God, it decreases maladaptive thoughts and behaviors. And in a sense, it decreases this uncertainty and, as a result, anxiety related to the uncertainty by saying, for instance, instead of wondering that, okay, I don't know if it's going to work and I think it might fail and whatever, but you might say that, you know what, God has a plan for me.
Sure.
And reframe your feelings of uncertainty with surrendering those feelings to a higher power that can take you throughout the journey, and that higher power, God, has a plan for you.
Absolutely.
That feeling of uncertainty is reframed in the context of, in a sense, God has a plan.
Yeah. Yeah.
And trust in that plan. And then the second thing is what I call it meaning making. And I take that from what we call coping stress theory. There's some theory in psychology called coping stress theory. And coping stress theory is the following, that if you attach meaning to your suffering, it actually causes less stress.
Sure.
So believing in God, in my opinion, that God has a plan and that it is not that you are experiencing random misfortune, but God has a plan for me and basically has a purposeful journey for me. That meaning making diminishes the stress.
Yes. Yes.
So it allows us to cope with it better through meaning making by relying on a higher power that knows the process from A to Z and allows you to, in a sense, overcome it. The other thing is in my opinion, is the improvement in emotional regulation. So let me explain to you what I mean.
Mm-hmm.
Sometimes prayers, reading scriptures, religious rituals have been shown to diminish cortisol levels and amylase salivary levels, and therefore scientifically decreasing stress. And therefore, this fact can sometimes help us in decreasing our stressors, even though the stressors do exist, by just engaging in spiritual activities. Because spiritual activities, when you're like in sync with God, in my opinion, it's a form of meditation. It's a form of relaxation. You basically tune out stressors, and that helps you decrease the stress. And sometimes a corollary to that is that if you go to places of religious worship, whether it's churches, whether it's mosques, synagogues, whatever, those communal behaviors sometimes navigate the next steps in a better way.
Absolutely.
So all of those are important. There is another one in my mind that just came up, is it allows you to buffer against negative thoughts. And let me explain to you what I mean by that. It redefines the notion, oh, I am a failure, I am broken, I cannot have kids, into telling yourself that my self-worth is rooted in divine love, in divine power, in divine everything. And therefore, you are not broken, you are not a failure, you're basically following, God's plan that God has for you. And maybe another aspect to this would be what we call hope and, how am I going to put it? Hope and perseverance.
Sure.
And meaning that in oncology, psychology, or in reproductive psychology, in both of those aspects, religious hope sustains people in repeated cycles. It allows you to go from cycle 1 to cycle 2 if they fail, but by saying to yourself that hope allows you to take care of yourself during that longer journey, because it might not happen from the first time.
Sure.
It might not happen from the second time.
Sure.
So that religious hope is extremely helpful, in addition to the obvious, the social support that, as I said, communal religious organizations help in this process. So I think this...
We got 2 minutes left, Dr. Shamma. So
let me tell you the whole of... Let's try to summarize.
Yes.
I think stress is part and parcel of infertility. I think stress can affect, if severe, can affect reproductive function in men and women to some degree. I think stress may or may not affect the success of in vitro fertilization. I think there are certain things, whether it's cognitive therapy, whether it is mindfulness, stress reduction, whether it's the other forms of acceptance and motivation and so on, and relying on a higher power and God can help us navigate this journey successfully with the help, if necessary, of mental health professionals, doctors, psychiatrists, and medicines if we have to at the tail end.
Absolutely. Dr. Shamma, a leading expert in reproductive medicine, I want to thank you so much for taking the time to be with us. Nothing better than, I remember when I had surgery and then I just said to the Lord, I allocate my affairs to you, you know best, and that calmed me down, and I went through it, and I know exactly what you're talking about.
Yeah, I mean, I wish the best for all my patients. I wish the best for all our listeners, and I see my job as a journey, as maybe trying to help people as best I can. Every single day I wake up with the notion that today I'm going to try my best to help people. Then I rely on higher powers to achieve that.
Wonderful. Thank you so much. We appreciate you being with us. As always, it's been a pleasure talking to you.
Bye. You take care. You and your listeners. Bye.
Bye now.